This is Dr. Gallagher. I am going to answer a very common question we get from patients, and that's how do we position the nipples for masculoplasty. So it is an art, and there are certain standard measurements, but I would say at the end of the day, this is the trickiest part of the surgery, and really where having a good aesthetic sense or keen eye is most important. Measurements are different for every patient. So what we do, as in this case, we sit the patient up, make sure they're level on the bed, and then at the end of the day, we eyeball it is the most important thing. There are standard measurements. We know that the male nipple should be at least 11 centimeters off the midline and about at the level of the fifth rib. So we do always double check these measurements, but at the end of the day, the most important thing is where looks good. And so with the patient in a sitting position, we'll measure and we'll mark and then go to the end of the bed, and oftentimes we'll take a vote. Several of the operating room nurses will be there, and so those who aren't invested in the case often are able to stand back and say the right side's off or whatever the case may be. So in this way we're able to reliably get a good nipple position.